Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you for having me on the program.
Yes, sir. Firstly, Minister, we wanted to address traveling and what is required in terms of coming in the country, and then more specifically, we wanted you to tell us the difference between the tests that are being done in Guyana.
Well, for international travel, we have a requirement, and that is persons coming to Guyana must have a PCR test. And the scientific name for this test is reverse transcriptase polymerase chain reaction. So it's called RT-PCR. And that can take several hours depending on the lab where you're doing it. And in some cases, they take a few days. So we have that requirement for persons to travel to Guyana. Now, once you get that test within 72 hours, and that 72 hours start counting from the time you get your swab taken at the lab. So that's the time that we start counting from. So if you're within 72 hours, then when you arrive in Guyana, you're not required to do a second test. If, however, your test is beyond 72 hours, but within 7 days, then you are allowed to travel on the plane. But when you get to Guyana, you would be required to do another PCR test at the airport here. So it is a simple thing. One, you must get a PCR test before you travel. If your PCR is within 72 hours, then upon arrival, you don't have to do a second test. If it is beyond 72 hours, but within 7 days, then you have to do a second test. Now, there have been some travelers who would go to their labs to get this test done, and sometimes the labs tell them that they're doing RT-PCR, but when they use the term RT-PCR, in a lot of cases, it refers to rapid test PCR. That is an antigen test, and that's not the one that we require. So this is something that people must understand. You have to get the right test, because if you come to the airport with an antigen test, then you would not be allowed to travel. So I hope people understand that, and that we, rid ourselves of this confusion that is currently happening.
Okay, Minister, thank you so much for that clarification. If we can, as we're talking about the airport, what are some of the other things that is in place at the airport for when persons coming?
So when you present yourself at your, wherever you're coming from, when you present yourself at that airport, the airlines would check to see whether or not you have the right test. If you don't, they would not allow you on. Once you have the right test, then you go through all the normal procedures, and then you come on the flight. Upon arrival here in Guyana, we have a port health department that is at the airport. You are required to meet with the port health officials, where they will go through a screening with you. They have a questionnaire for each passenger, and you go through that process of screening. And if they determine that you need that second test, then Eureka would be able to take off the swab and to do this test for you. That is a totally private arrangement. I see there have been some confusion. It's not the government that is collecting people money and thing. This is a private sector arrangement with the airport. The government of Guyana, while we want this process to be in place for the safety of people, we are not responsible for those payments. Those payments are made to the private sector laboratory that then, would be able to do the test for them.
As we're on the same topic of the airport, how has it been? I know initially we had an issue with the information and so on, and then subsequently that was clarified. Since then, that time to now, how has the process been?
I think the process is much smoother. So we have been able to learn from past mistakes, and I think now people coming in would have a more easy flow. Of course, as you know, with the holiday season, we're getting a lot more flights, and therefore we have to ensure that we have all the processes in place to make sure we still have that smooth and safe flow. We also want to urge the passengers to work with us to comply with the measures that we have in place, because as you can imagine, we want everybody to be safe. We have had, since we have reopened the airport, we have had 20 imported cases, and we have reached out to those persons. We have told them they're positive. We have explained to them the measures that they need to take, and we have been monitoring them. So we are going to continue to do that. In addition to those passengers who have tested positive, we would normally reach out to the persons who sat next to them, like the rows in front, side, at the back, because these other passengers would have been in close proximity to the infected person and would have been, for a number of hours. So the possibility of spread is there. So for those other passengers, when we reach out to them, we are trying to get them to quarantine themselves so as to look to see whether or not there's the development of the infection, with them. So it's a process, but so far we've had 20 imported cases.
I have another question here based on the same thing. You mentioned quarantine and so on. I know it's the Christmas holiday and persons are coming into the country, families, they have family gathering. But for those persons, I know initially you'd indicated that persons can ask to be quarantined if they can't quarantine at home, right?
Yeah.
So that is in place still.
So one, if you tested positive and you're not able to isolate yourself at home, then we can put you in one of our institutional isolation. If you need to be quarantined and you cannot be quarantined at home, then we can also quarantine you in one of our facilities. So these things are available.
Okay, Minister, thank you. I wanted to touch on gatherings, because as we're on the topic of Christmas, we have a lot of, usually we would have a lot of religious gatherings and so on. We know there are specific guidelines. Could you talk to us about that?
Well, our guidelines are very clear, and that is we have a curfew that starts from 10:30 in the evening or in the night, and therefore for persons who are normally accustomed to have Mass later on, they'll have to adjust to these guidelines. As you would know that for the Christian community, the Vatican has provided special guidelines during these COVID times, which include, like on Christmas Day, instead of having maybe one Mass, they are now permitting that you can do more than one Mass with smaller gatherings of people, so that everybody who is desirous of going to church can do so, but do so in a safe environment. And I guess for other denominations of Christianity, they have similar arrangements in place. But again, we want to urge people to take these precautions seriously, because I don't think anybody would like to have their congregants coming to church and getting infected. So we all need to abide by these guidelines, and once we do so, we all would be safe.
The small gatherings that you spoke about, I know there's a specific number, I can't recall at the time, at this moment. Do you?
Well, the guidelines we have provided for, I think, up to 10 persons in smaller gatherings, and this is something that we are urging people to abide by.
Okay, thank you, Minister. Could we do a little recap on the communities? I know we've Aurealis Separuto, we've been tracking that as well as Bartica, and then of course New Amsterdam. Any updates today?
Well, I think the main sites now that we are looking at would be in Bartica, where we still have a number of cases. A few days ago it was at 70, it has now come down a little bit, but we still have to continue to monitor. And the other area that is of concern is in Linden. So there are a number of communities there that we have been tracking because they've had an increase in cases in those communities. So these are the two main areas of concern right now. That does not mean that we have turned down the level of vigilance in all parts of Guyana, because our health team, our regional health teams, have been constantly monitoring across the various regions. So we'll continue to do so, but as of now, these two areas are the places where we have seen more cases so far.
Okay, I have a question. I have to read it for you to get it correctly. So, we've seen several advertisements recently for the supply of medical equipment and supplies for the ministry. Is this an indication that the procurement process at the ministry is being streamlined given the massive shortage and stock of expired drugs which you've inherited, basically?
So, well, yes, because what we are trying to do now is to ensure that we have enough supplies, and we have been going out to tender to ensure that we have adequate supplies. You know, we had severe shortages of a number of essential medicines, so we're trying to remedy that. We also had shortages of reagents for laboratory equipment, so that too we are working to make sure that we have adequate supplies. So we have, over the last month or two, been trying to get emergency supplies so that we can make the system work. And then we are now trying to get a much larger quantity so that we can have maybe for about 6 months. By next year, we'll stabilize the system because we'll have adequate amounts so that we can plan properly and make sure that we try to reduce the level of shortages. But as it is, because as you recognize, while we'll pay for these things, they'll still take a little bit of time for the suppliers to get them in country. So that sometimes can still have a lingering effect on the shortages that we have. But we're working to really alleviate this because we understand the challenges that people have when they come to the health center, the hospital, or they can't get medication. And we are really, really working hard to remedy that.
Okay, Minister. And just for clarity, this of course includes shortages of GPHC, and this is separate and apart from the COVID-19 drugs.
Yeah, so the Ministry of Health, we normally procure for most of the health facilities and regional hospitals and so forth. Regions would retain a small part of their health budget to deal with emergency supplies that they might need, but by and large they get most of their supplies from the Ministry of Health. The Georgetown Hospital is a cooperation, so in our budget we'll normally give them a subvention which would cover procurement, whatever they need to procure, they can use their subvention to be able to get that. So there are different streams of procurement, if you like. Georgetown Hospital is responsible for its own procurement. But because of some of the challenges that they have been having, we have tried to put some emergency measures in place, because if they have shortages and we have at the MMU, obviously we can give them some of the medicines that we have until they're able to procure their own. And that's what we have been working on to help them to remedy their shortages so that the system as a whole would be able to get enough medicines. The ordinary person out there does not make a distinction between where the sources of funding and whose responsibility it is to procure medicines. what people would like to know is that when they come to a health facility that they're getting their medicines. And so we have to rectify this. This is, our jobs, and therefore we have to ensure that we get medicines in the system so that the patients can have it.
Okay. Minister, my final question to you. In terms of government coming into office in August, in terms of implementing the plan of this particular administration, can I ask just your thoughts on how effective your plan has been? I know there have been challenges along the way and we're in a pandemic, but what are your thoughts on what you've implemented thus far? And basically, how do you think you've performed?
Well, that's probably an unfair question to me because you'll have to ask maybe other people to do that evaluation. But by and large, what we have sought to do immediately upon assuming office in the Ministry of Health is to try to work on the pandemic. And I think we have been able to improve the response to the pandemic. So we have been able to add testing capacity, improve our drug supplies for patients with COVID-19, get all the necessary ventilators and so forth, build out regional ICU, have more ICU beds nationally, bring the Ocean View facilities into use, and start managing a larger volume of COVID-19 patients, because as we start doing more testing, we are finding more people. We have also been able to understand more in terms of the sciences, and we have looked at how to manage the mild and moderate cases of COVID and even forms of long COVID. So we have done a lot of things as it relates to COVID. And I think now our response is more robust than what we have inherited just a couple months ago. We are going to continue to do that to make sure that we can get people, keep people safe. And our next set of measures that we are looking at is to really procure a safe vaccine for everyone. And we have started to ready the system to be able to give that vaccine to everyone. So outside of COVID, we have also looked at a number of the other programs, so things like diabetes, hypertension, cardiovascular diseases. So we've had some initial discussion on some of these non-communicable diseases, and we have worked out different strategies on how we are going to improve the management of these conditions in Guyana. You would see in early 2021 the introduction of new programs, so programs dealing with cardiovascular diseases, for example. We'll be rolling out such a program in collaboration with PAHO. You will see a more robust response to cancer, because this is another chronic non-communicable diseases. And here again, we'll be rolling out some new initiatives. We'll be ramping up some of the current initiatives because they haven't been working as they should. So what we are looking at, these things you wouldn't see immediate effect, but in 5 years from now, you will start seeing the impact of some of the measures that we're taking now. So it's essential that we take these measures so that we have that type of improvement. Similarly with diabetics, because one of the things that we have not, our diabetic services have been a little bit fragmented, and many of the things that we have put in the past, like foot clinics and so forth, are not operating as it should. And therefore, all of these things we need to improve. So we want to offer more integrated, comprehensive services for diabetics. So from the management of your glucose, to the types of labs that you need to get, making them available to people, getting medication for persons, looking at complications of diabetes, how we can prevent those complications by doing faster labs, looking at complications relating to eye, being able to screen diabetics to see whether or not their eyes are deteriorating, looking at foot care, improving that, looking at prosthesis. So we want to bring all these things together and make sure that in every region we have centers that can really improve diabetic care. And of course, there's been a shortage of insulin, and we want to also remedy that so those persons who need insulin can really access insulin and so forth. So in terms of chronic non-communicable disease, we've had a lot of focus on some of these things, and you will see a lot of rollout of these programs in 2021. We have also been looking at some of the infectious diseases. So we have focused on a number of the neglected diseases. And again, starting from February 2021, we'll have the mass administration of drugs so that we can work for the elimination of filaria. We have a program that will be targeting in a focused way leishmaniasis. So that, again, we'll roll that out next year. But we have been doing some background work on it. Malaria, which has been a very troublesome disease in this country and has been with us for a very long time. We are going to have several approaches on how we deal with malaria. Some of it relates to preventing malaria by using the medicines and so forth, prophylaxis, using insecticide-treated bed nets. But on the other side, we want to reduce the population of the vector, which is the mosquito itself. And so we will be introducing some new strategies to deal with the reduction of the mosquito population. HIV is another area that we have looked at, and by next week or so, we'll be releasing a new HIV plan for the next 5 years. And in that plan, you would see some of the new things that we'll be doing as it regards to HIV. So, I mean, in the last few months, while COVID, we have focused on that to stabilize our response, we have not neglected the other areas. And we are doing all of this with a very broken health system. So we are trying to stabilize the system, fix things, make sure that we have adequate drugs and medical supply, make sure that we have laboratory reagents, fixing X-ray machines, making sure that they're working properly, getting our CT scans up and running, you know. So a lot of the diagnostic equipment that we had were not working. So fixing all these things while at the same time, you know, looking at how we improve the programs, this is what we've been doing over the last couple of months.
Okay. Minister, I must mention, honorable mention should be made of the training that your ministry has been doing in the last few months, especially that it's we're in a pandemic, but I noticed that your ministry has scaled up on training for health workers as well.
Yeah, and we'll be doing more of that because another area that we have looked at is streamlining the existing training programs that we have, improving the curriculum, making them more updated with what is required to provide modern medicine, and also looking at new areas of development in terms of training. So, you know, in 2021, you will see many of these things being rolled out.
Dr. Minister, thank you so much for speaking with us.
Good, thank you.
All right, well, that's it for today's COVID-19 update. Of course, we were speaking with the Honorable Minister of Health, Dr. Frank Anthony. For these and other information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.